everyone. I am Kimbra, and I'm here in Los Angeles. I'm here with my friend Kelly Nicholson in Wyoming. And today we got a really hot topic for you. We're going to be talking about universal health care, right, Kelly?
Yep.
So what do you think?
Well, we both took notes. We both did some research because we want to be accurate in what we're sharing.
Right.
So there's different definitions. Universal health care is just when everyone's covered.
Right.
And then single payer, because you and I were talking about what's the difference. Single payer is when there's one entity paying for everyone,
Exactly.
usually the government, and that's like Medicare. So Medicare for all would be universal health care paid for by our government.
Universal health care, I guess, is just the umbrella expression.
Yeah, just that everybody's covered, that nobody's not covered. And so we would, like single payer, if we were doing single payer and the government paid for it, we would be taxed. And then the argument is that people don't want to pay higher taxes, but you wouldn't be paying your premium, your insurance premium. So you'd actually be paying less, unless.
Well, it depends on it does depend though, exactly on how much. That's the part that was confusing to me, that I'm still not quite sure exactly how much our taxes will increase, because I was trying to.
It's like if we were doing the math and the math was right, it would be less than what we pay for insurance and insurance premium. Like if you're a regular person paying for your health insurance through insurance, a private insurance, how much it would raise in taxes would be less than your insurance premium. So let's say you pay $500 a month for your insurance premium. You might end up paying $300 or $400 more in taxes, but you don't pay that $500 insurance premium, because the idea, and this is all conceptual, the idea is that we're cutting out the insurance company, and the insurance company is a profit organization. They've got lots of overhead, all the people that they're paying and everything. So you're really getting rid of a big part of the expense. So
those are the ones
lower cost.
Yeah, that's one of the entities that's going to fight it the most is the insurance company, because they're the ones that are going to.
Yeah, and they're lobbying and they're putting out lies because they don't want to go out of business. They don't want to lose their business. And my thought is too bad. Things progress. We change throughout all, I think years ago, you and I were talking about what happened with the industry for musicians. When people started downloading free music online and people weren't able to sell records anymore. And, I said, I have lots of musicians friends. You're one of them. Some of them that made a lot of money in the business, and some of them that didn't make a lot of money, but they're, very talented. 100 years ago, there weren't CDs and records, and musicians had to perform live, and that's the only way you made money. So throughout time, things always change, and you have to evolve with those changes. So as far as the insurance industry, it's going to be, just like Blockbuster, videos, those are out of date. Those companies went out of business because innovation, technology changed. And so the same thing will happen with healthcare. Those people will have to get other jobs and different kinds of businesses, and it's an ever-changing world. So I just find that a moot point. It's ridiculous to even consider it.
Yeah, I was just talking to someone in my family about it, how this insurance company that we use this mom and pop family-run insurance business. And back in the day, whenever they probably started in the 60s or maybe the 70s. A lot of those original companies made a lot of money. It was a really profitable thing to get into, insurance.
Yeah.
So, businesses change. They have their day, and now we've got to look out for the insured, But I did I was just going to say one thing. There's some statistics that I was looking into that U.S. Right now we have about 10%, on average, we have about 10% of Americans are uninsured, or about 27.5 million. Through the whole thing, 56% usually go through an employer. If you have a job that provides you, healthcare, 8% through private market, 22% is Medicaid for the poor, and 4%, I guess, is other public sources, maybe like veterans or something like that.
Mhm.
But I mean, with 27.5 million is a lot of people, you know?
Yeah, that's a lot
So,
of people without insurance, and we're still paying for their care.
sure,
That's another argument. Well, I was going to go through the definitions first of the different
sure.
kinds. So universal health care means everyone's covered. So I'm reading from my notes here.
Mhm.
Single payer means there's one payer, everybody's covered. They've got universal care. It's like Medicare, like the government's
Right.
paying through our taxes. Socialized medicine. So the other argument is people say it's socialism. It becomes socialism. Socialized medicine is like the VA, the Veterans Administration, where the government not only pays for the health care, but they operate the medical facilities, the hospitals, and they employ all of the healthcare professionals. So
Sure.
that is socialized medicine. That's
Right.
socialism. And, the government isn't good at it. The VA has had a lot of problems. So single payer or universal healthcare does not have to be socialized medicine. Then the Medicaid, which you already mentioned, is for people who can't afford to pay,
Sure.
which the rest of us pay for, just like all insurance. Drivers, we have auto insurance. You're paying for other people too. You may be a good driver and never get in an accident, but you're still paying your premium for the people that do. So that's the risk of insurance. That's what insurance is. And then, Medicare is for seniors, but they're talking Medicare for all would be what the seniors get, the coverage that everybody would get, but it doesn't pay for everything. I didn't know that either. Medicare, we all throughout our lifetime pay for it out of the payroll tax. So now, right now, Donald Trump is talking about giving the payroll tax a holiday. That money is used to pay for Social Security and Medicare. So that would be less money for Social Security and Medicare, which is why it's probably not a good idea.
I was reading that like 1.5% of our earnings when we pay into FICA, that goes towards Medicare.
Yeah, and then like 6% goes to Social Security.
Yeah, and then employers pay another 1.45.
Yeah, they match it. In addition to Medicare, so then there's Medicare Part B for the seniors. They pay, it's like they're in separate insurance, and they have to pay for it out of their Social Security or whatever money they have. And that is a supplemental insurance to make up for what Medicare doesn't pay. So I didn't know that. And their glasses, their eye care, and their dental care is not covered also. So our seniors really don't have it as good as I had thought with Medicare. Then the public option is a government-sponsored insurance. So the government just does the insurance. It's giving us a better rate, I guess, of insurance because it's not for profit. And then, of course, if we do any kind of insurance, we can also have those Cadillac policies where the elective procedures and the cosmetic procedures and things that aren't necessary.
Which is what they do in Canada and I believe the UK too. You can opt to get, private insurance companies if you want more specialized care that the normal national health, NHS, I believe it's called in Europe, in England anyway. They're kind of, it's like their public insurance, but you could also do private over there as well for specialized care.
Yeah, I think no matter what kind of insurance we end up having, you can still have additional insurance if you want to. I think also, like, let's say we did go to Medicare for all, and let's say you want a better policy, you can pay. I would propose that you can pay more for your own private room or private nursing care, or you can always add to it, I guess, or better quality glasses or more choices of designs or whatever. So I think that's also it always will be an option. So people that say, you're not going to get quality health care, you're going to get less care. That's a concern. There might be longer wait times because we have more people using, it's funny when all this talk started coming about, I thought, because they were saying people will take advantage and people will start going to the doctor all the time. And I was like, who wants to go and sit in a waiting room and be prodded and poked by a doctor? I just can't imagine that people would take advantage of it.
And conversely, they're saying that most millennials are putting money ahead of their health, because they're taking into consideration, do I want to spend the money on health insurance or, can I afford it? Or do I want to go to the doctor? No, because when you're younger, you always think, you don't really think about it as much.
Sick. Yeah.
And so one of the pros is that if everybody has insurance, and that's really the only way most of these plans are going to work. Everybody has to opt into it to make it work. And anyway, one of the pros is that we'll have a healthier society, right? Because people, we want people to go to the doctor, we want people to get checked.
A lot of serious illnesses, the expensive part of it, like the surgery, everything can be prevented if you do preventative medicine.
Sure. Right.
So if we get in the habit of going on our annual physical and catching things before they get too far along, that could bring down healthcare expenses too.
Exactly.
And again, I don't see people lining up to go to the doctor all the time and taking advantage of it when they don't need to. I just don't see that happening. I may be wrong, but I just don't know who would be happy to do that. Go to the doctor.
But again, I think it's good if everybody goes to the doctor, because in the long run, if you do the preventative care, it may catch something before it gets serious, and that's when it costs a lot of money. If you go for your breast exams, or a lot of women will be able to catch their breast cancer if caught early, supposedly very easy.
Yeah, you can just
manageable
get it
anyway.
Cut out while it's still a little dot, a pea-sized dot, before it's out of hand, and then it's tens of thousands of dollars in surgery and everything.
Exactly.
So I have a list of pros that I thought were good reasons to not have private health insurance. And a big one is it's tied to employment. I know a lot of people, as they start getting older, they don't want to retire early. They don't want to retire until they have Medicare, until they're eligible. And some people don't want to leave a job because they're afraid they won't get another one, or they don't want to start their own business, or for whatever reason, they stay in a job that they're not happy with, just simply for health insurance.
That's true. Good point.
And I don't think that's a fair advantage. And I don't think it's fair to employers to have that responsibility to supply health insurance for their staff.
And that's one of the pros too that I was reading about, that it's better for business, because a lot of Americans, as I pointed out earlier, get it through their work. But if businesses don't have to supply health insurance for their employees, then that will help them bring their costs down, right? Yep. If they don't have to worry.
Or they can pay better. They can pay better. And it would bring some of the cost, pay better, so they're more competitive in the market. I don't think it's a good idea to tie healthcare to employment. What about the stay-at-home mother, or what about people that, like you said, want to go off and start their own business, and they can't, afford to buy their own health insurance, so they stay in a job, and that stifles their opportunity to start a business.
If you like our videos, go ahead and click on like and subscribe. We really appreciate it. Thanks.
Another thing I had was the red tape. I had a Chinese student staying with me. You met her, many times, Kimbra. And she stayed with me through her high school years. And when I took her to the doctor, she would always be surprised that we had to sign paperwork and pay and fill out forms. And she said, in China, you just go to the doctor and you just leave, and you don't pay anything. You don't fill out forms, and you might have to sign something that you had, something done. But she was always surprised. And I think it would take it would definitely lower the cost for doctors, because they're paying for the medical coders, and they do a lot of, they spend a lot of their time on paperwork, and that time could be spent seeing patients. So maybe it would free up the time of the doctors, and there wouldn't be so many wait times if doctors didn't have to go through so much of the paperwork.
Yeah, and speaking of doctors, that was one thing that I was thinking about when I knew we were going to talk about this. I thought to myself, because I had a discussion with someone about this recently who was actually a doctor, and she was saying, she doesn't believe in universal health care because doctors will be paid less, and it costs a lot of money to go to medical school, and blah blah blah. And I was thinking, I don't want doctors to get paid less, so because we don't want people, we want the best care that we can get. And if medical school costs a lot of money.
Who says doctors will get paid less? Like, who says that? Why do we have to pay them less?
That's one small slight fear. So I was looking up, in Canada, and they were doing a census over there, and that the doctors, when they did go to what their version of single payer is, the doctors didn't get paid less, because of several reasons, but a lot of the administrative costs are not as much anymore. So some of that money goes, to the doctors. So there's been many studies about it, and it's not proven that doctors will make less. It's quite the opposite, actually, So.
Well, I think that's up to us to decide. That's the thing. Everybody gives away their power. They say as soon as the government takes over, and I get it. We do lose power, but we're losing power because we're giving it away. We're not fighting back. And if enough people, and we've seen recently, if enough people to get together, and we should be the ones that decide. I almost feel like they should be giving every home, how they do the census. I feel like they should give every home a questionnaire, but it should be detailed, and it should be with options, not scare tactics, not just leaning people to one side or the other. But we should design our own health care and how we want to pay for it. Because I think there's the lobbyists are putting out so much incorrect information and using scare tactics to get people not to want to do it. And, because the insurance companies make so much money on it. But if the medical professionals don't have all that overhead of hiring people to do the paperwork and all the administrative parts, that's more money for them. And if the government is paying for it, I understand they want to put a cap on procedures, but I think that should be comparable to what we're paying now. I don't think it should be less. I don't think doctors should make less money.
No, definitely not.
I think they should make more money, because let's say a doctor spends 2 hours a day on administrative things, filling out all the paperwork. Well, that could be 2 more patients that they see every day. So that's more money for the doctor. So I don't think it has to be that way. And one of my frustrations is people don't think. They just, see something on TV, they accept it. Oh, okay, we'd have to wait longer. Instead of thinking a little further, altogether, us figuring it out ourselves, and then going to our representatives on a state level or national level or whatever, and saying, no, this is what, write a letter. This is how I think it should happen. And this is what I think we should do.
Well, that is one con that I was reading about, that there is longer, like I was trying to compare here to Canada, because there's several countries that have a really good model to study: UK, Canada, Taiwan, Germany. But I felt like because Canada is so close to us, to me it seems like the most similar, right? So I was reading that the wait times are like on average 22 weeks to get to see a doctor, or maybe a specialized doctor. So I'm not sure about that, because I'm not Canadian. I've never lived in Canada. So I would like to hear, maybe somebody out there knows,
I saw, I've seen a couple of videos about it from Canadians, and the wait times are longer for elective surgeries, not for cancer and stuff like that.
Right. For not serious things, it's not as long.
Well,
wait for serious things, I mean.
The type of insurance doesn't affect the wait time. And that's another, myth that they're putting out there. The wait time has to do with number of doctors. So if we want more doctors in an area, we have to give them incentive to go to medical school. So that can be done with, help with college, letting them know that they'll make good money when they get out. I mean, right now there are certain specialty areas where you have to wait a long time to see a doctor, even if it's an emergency, even if it's something, not an emergency, but like something urgent, something important. There's people that they've gone, they got a test and they have cancer and they can't get into the doctor for 3 weeks. That should be something you're in next week, but they can, or sometimes 6 weeks or whatever. So that's a myth. That's just a lie that they're spreading to make people scared of single payer.
Well, I hope you're right, because I was a little worried about that. I mean, I would like to hear from anybody that, maybe a Canadian.
Well, again, it's math. How many doctors do we have in that do that specialty?
Right. Well, no, what I mean is,
that determines your wait time.
I mean,
it's nothing to do with insurance.
Well, no, right? It's math, but I'm saying, I want to know, like, now from some Canadians, is that really true? Do you have to wait longer? I want to know what's going on, because like I said, I've never lived in Canada, and I have several Canadian friends, and I would like to know, is it true? Do you really have to wait that long now, in Canada? So
how would that matter as far as who's paying for it? How long they have to wait? Maybe I'm wrong.
What I meant by that is, one of the cons that they talk about is, the average wait for anything. They were making it, when I was reading about stuff, they were making it seem like wait times were at least twice, if not 3 times longer, even just for a general appointment. So that may be true if you're saying we're going to style the voters to decide, we want to decide what we're going to do. But I want to know, my question was, is that really the truth for my Canadian friends? Do you really have to wait longer?
But what,
you know?
so I'm not seeing the correlation between who pays for it and the wait time.
Oh,
What would be the correlation? Why would
well,
that matter?
the correlation was that that's one of the cons because, you know, I guess because there's more people waiting and not enough doctors, like you said. Probably not enough doctors for the amount of people that want to see the doctor or have an appointment. So they're not giving their patients choices. They're not giving their patients enough choices. They're saying, this is when I can see you, and the patient doesn't get the chance to make the appointment, from what I was reading.
But
you know?
what does who's paying for it have to do with the number of people that have a certain kind of illness?
Well,
I
I'm not
don't-
following what you're saying. What I'm saying is one of the cons, the only 2 big cons that I could think of from what I've been reading online is the wait times are longer because,
Yeah, they say that's a
because-
con.
yeah,
But why?
because maybe they don't have so many doctors that are available. Like maybe in America, are there more doctors that are practicing? I don't know. You know, because it's a
But why
business.
would it matter who's paying for it? Why would that? I'm not saying the correlation. I know that they're saying that, but
Mhm, mhm.
nobody has.
I guess
they're
because
saying
they're
that
trying to say,
it's a scare tactic.
right.
Because
Well,
there's
may
a
be a
certain number of doctors.
Yeah.
So who's paying for it doesn't change how many doctors we have.
Well, because they're trying to say, or people that are against not social,
Right.
Single payer, is that because it's not run like a business where there's more, like America has better service because we're all paying more money. We're over there, it's more run by the government. So anything that's run by the government, there's going to be longer wait times. It's not as organized. It's run like
Single payer isn't run by the government. Single payer is just paid for by the government.
Right,
They just pay the bill.
But people say that anytime the government is involved, then things are not going to be run as quick. A lot of people say that.
Right, like the VA.
Right.
But that's the myth.
Right.
Because single payer is not run by the government.
But all I meant,
just like the government writes the check.
Right. Regardless of all that, we just talked about my thing, and I think it's a valid question. I just want to hear from somebody that's really Canadian or that spent a lot of time in Canada. I want to hear, like in the comments, is that true? Do you really do have to wait a longer time? Because that's a big myth, and I want to know.
But why do you think that would matter, Kimbra? I'm not following you. Why would it matter? Because if Canada has fewer doctors, that's why you'd have to wait longer. It's nothing to do with who's paying for it. I'm not.
Well, because I want to know, is it a system that they like? If you are Canadian and you've lived in America, and you go to the doctor, and you probably, I don't know if you've been to an American doctor or not, but I have friends that are Canadian that go back quite a lot to,
right.
For procedures and such. And I've never really talked to them about it. I want to know the nuts and bolts of that system. Like,
that's a valid question, but the wait time doesn't have anything to do with, the wait time is about how many doctors we have.
Right. Regardless of how many doctors.
And if we went to single payer, and let's say, like I said earlier, every doctor has 2 hours extra a day. I know you're doing the devil's advocate and you're saying what you've read, but I'm myth busting it because let's say every doctor has 2 extra hours a day now. Every doctor in this country now has 2 extra hours to see patients. They're more available now. There's more appointments available because they're not spending that 2 hours every day filling out paperwork.
And that's fine. No, you have made some good points. I just wanted to know.
It's an example of people not asking questions. They just get online and go, oh my God, you have to wait longer. And what Canada's doing has nothing to do with what would happen here, because what would happen here depends on how many doctors we have. Canada might not have as many doctors. So we want to encourage people to go to medical school.
Sure.
Let's say we have a shortage of doctors. We encourage people to go to medical school.
Sure.
We don't not take care of. I don't know. It's just like we got to learn to think through the process and add it up.
Right.
And that's
but I
what
also
are
just
doing.
right. And but again, I just want to hear from people. We want to hear from you.
Yeah.
Yeah.
I guess I'm a little less interested in that because I've already done a lot of research and read about people in Canada that have, but I don't know any personal experiences. So
I have 3 good friends that seem to like it a lot, and I don't know if it's because it's free or if they had their druthers.
And they might not be able to, if they haven't been here, they can't make a comparison. So you tend to like we like a lot of people like our healthcare system because they have nothing to compare it to.
Sure.
And people that have gone to Europe and had an accident or something there, they come back here and they're like, oh my gosh, it's so different.
Well, I spent some time in Europe, 15 years ago, and I was singing there, and I think I've told you the story before. I was at a dinner party or something, and I had this thing I had to get checked up on, and I happened to be talking to a doctor, and he said, well, why don't you come see me tomorrow at my office? I was like, oh, well, I don't have insurance. And he said, that's okay. It's, it's free. And I'm like, really? So I know in Italy, they do, even if you're a tourist, you can go see the doctor. It wasn't free. I shouldn't say that. It was but it was very reasonable. It was like a fourth of what we would pay. So I was immensely pleased with that, as you can imagine. But now I know some of those other countries in Europe don't do that. They don't. Tourists, and if you're on a visa, you can't go to the doctor. You have to pay just like a regular, person. But anyway, there's,
He said that, why don't you come and see me tomorrow?
Well, I might be exaggerating, but I know I got in quickly. I don't know if it was tomorrow.
That's not a very long.
But you got to remember, this was in Italy. It's a lot smaller country. But anyway, what else was I going to talk about? The pros, the cons.
Well, I had another thing to point out is, how they say the death panels, they don't want government death panels. We already have death panels, the insurance companies. They decide what's covered. And there are people that get cancer and they won't cover it. So we already have that. So that's another true. Myth, another, people, just reading what they see or, listening to what they hear on TV, reading what they see on the internet and not thinking deeper we have to start thinking deeper and ask questions. Why is that? Another thing is they say, oh, we want a choice of doctors. If we have universal health care, you can go to any doctor you want. Right now, you're limited to who's in your network of insurance. So we have much more limited choice of doctors the way we're doing it right now.
The biggest pro, in my opinion, and this is more of an ethical, philosophical thing, but a pro, if everyone is covered, and again, that's the only way it's really going to work, or we're going to make this work for the universal health care, if everyone is covered, but it would automatically become a right, like I said earlier, people are putting money ahead of their health. And I personally would rather pay a little more taxes. I'm hoping that it's not going to be, we have to see, we have to see the numbers. That's I've never seen a proposal yet that tells you exactly who's, going to pay for what, but I would rather personally pay a little bit more money for taxes and for healthcare and education. And I don't even have kids, but I would rather live in a smarter, I would rather live in a smarter society.
Smarter, healthier country. Yeah.
Exactly.
Smarter, healthier.
Exactly.
I'm with you totally on that. And so if we got rid of private insurance and just, have the Cadillac policies for people that just want better service or whatever, and electives and all that, they can still have that. And doctors go into specialty practices, but we would save money on all the administrative costs and all the advertising.
That's true. That's true.
The pharmaceutical industry spends more money on advertising than they do on research and development. And then they say, well, if it's not for profit, they're not going to research. Our government supports our government's paying right now for research for a COVID vaccine, for the COVID-19 vaccine. So our government's already, the NIH, what's that stand for? National Institute of Health, is an organization that the government supports for medical research. We support a lot of, they give grants to colleges, universities for medical research. So we're already spending money on research. So that doesn't have to stop either. That's another, just another myth that the insurance companies or whoever is against private or single payer that they're putting out there. So we would actually be, we would save doctors time, so there would be more availability of doctors. We would save money on the advertising, and it's really unethical. In fact, there was a time when it was unethical for insurance companies to make money, to profit off of health. I think Nixon changed that. I think in his time is when it was changed. But at one time, healthcare was not profitable. You couldn't make a profit.
Actually, I had a separate thought that Nixon actually did. I was talking to someone that he actually was proposing to have some kind of universal health care.
Universal health care.
Yeah, and he actually was into the UBI too, universal basic income, and I was like, wow, I never knew those good things about Nixon.
Yeah. Well, the Republicans have gone so far right.
Right.
And that's because of they started these think tanks and started all this propaganda, and then they brought the left with them. The left is kind of where the Republicans used to be, and the Republicans are just off the charts. I mean, they've just, and it's sad that they've fooled so many people, both sides. So that's my opinion.
Well, one thing that we haven't talked about yet too, Joe Biden is running for the Democratic nominee, as you know, and I was reading a little bit about him. His proposal is to expand on the Affordable Care Act, so that'll be interesting to see if he gets into the White House, how that will work, because he's kind of not really pushing for universal health care as much as he's pushing for expanding the Affordable Care Act, also known as Obamacare. But Kamala Harris, I was reading, she had more of a single payer idea, I believe. So it'll be interesting to see if they get in, what happens, Well,
what bothers me, I guess, or what I hope if Biden wins, that they also have a Democrat Senate and House, so that they can't do this blaming again. The Republicans stood in the way. Obama did that. He had a Democrat Senate and House. He did nothing. Obamacare was an abomination. It is not a good healthcare system, because still there's 27 million people that don't have healthcare. And then it also put middle class people who could no longer afford it. So that was an abomination, in my opinion.
I do know a lot of people that liked the Affordable Care Act. Our one of our guests was telling me, earlier in his career, he got on the Affordable Care Act when it first was established, and it helped him out a lot.
Yeah, it helped some people, but then it left a lot of people out too. So it really was just changing one group for another group, and that's what our government does. A lot of times they pick winners and losers when we should not have losers. Everybody should win. We're a rich country. We can afford it. And if we did it right, everybody could have health care. We shouldn't have to pick losers. We shouldn't have to have 27 million people without health care. And middle class people who have a family shouldn't have to spend $1,000 a month to cover them and their kids. It's ridiculous. So anyway, that's my thought on, I don't have a lot of faith in the Democratic Party. I'm an independent, but I've always voted Democrat. But I don't have a lot of faith in what they're going to come through, because all the lies Obama told and all the disappointments that he caused, in my opinion. And I thought Obamacare was nothing but a big disappointment, and just switching one group for another group. So yeah, we insured these 30 million, but then we left these ones out.
Well, it was a step. I know it didn't go far enough, and I personally believe that there was a lot of compromises he had to make because of several reasons that I'm sure I'm not privy to.
He didn't have to make any compromises. He had a Democratic House and Senate. He didn't have to make any compromises. He chose to do that because the people that had donated to his campaign, that's what they wanted. So,
well, I'm not going to get into that.
He sold us out. But anyway, that's my 2 cents. That's my 2 cents.
I actually do like Obama. I mean, I don't want to get into him, but it's funny because when he first was running for president, I wasn't into him like everybody was. Everybody was like, this is going to be our savior. This is going to be, and I don't know why I was so cynical. I was like, nah, not going to happen. But, and then looking back, there was some things that I did appreciate about his presidency, but I know you're not a big fan of his, so we won't get into that right now.
Well, since it's brought up, I would like to say why. Because
Sure.
number one, he didn't give us the health care that he should have. Number two, he prosecuted more whistleblowers than any president has in history. And they were doing the right thing and exposing what was going on in our country, and they still are. He expanded spying on people. And the average person says, well, I have nothing to hide, which is just pure ignorance, because we're not worried about you and what you have to hide, or me. We're worried about our politicians and, what's going on with Russiagate and all that. He let the country down, and a lot of people just don't know why. I voted for him twice. I voted for him both times. What happened in 2008? Everybody was for Hillary. Nobody knew who Barack Obama was. We didn't even know who he was. And I remember everybody wanted Hillary, and the DNC chose him. And so we didn't have a choice. He grew on us because he's such a likable guy. He's classy, likable, handsome.
Very educated.
Michelle, the family are beautiful. Yeah. So they're, likable people. So they were sold to us, forced on us. We didn't choose him because nobody knew who he was. Hillary was set to win that primary. But the DNC chose him. Then the next 2016, again, the DNC chose Hillary. And that's my issue, is we are really not choosing our candidates. We are letting lobbyists and wealthy people choose the candidates, and then we get to vote, from their choice. So that's my issue with it. And Obama did a lot more things. The wars over in the Middle East and bombing all those countries, and he was very much a hypocrite, and I'll never know, we'll never know why. Sometimes I think maybe he was threatened, because I don't want to believe that he was that bad of a man. But if you, do a lot of research, he's not a good man. But that's my 2 cents, and I know you feel otherwise, and a lot of people do. So.
Well, again, I'm a weird person, because in the beginning I wasn't sold on Obama, and then he grew on me.
Nobody was, because we didn't know who he was.
A lot of my friends were. I believe just because with Obama they saw hope, but for some reason I was very cynical. I was like, no politician can do all that, So I guess I wasn't as disappointed as some people might have been, but I look back and I feel there are a lot of things that he did do. And for me, the Affordable Care Act was a good thing for my friend. I personally saw a lot of people that got health insurance because of it. When Trump got in, he negated the mandate, or he didn't, what is the word? He didn't make it a penalty to have you didn't have to have, insurance.
Right.
So that kind of really put everybody in their knickers in a twist, because the only way it's going to work is if everybody has to.
But it didn't really change anything, because nobody lost insurance because of it. And,
Well, no, but it was, it helped actually a couple of friends of mine, because some of my friends that
because Obamacare made it unaffordable, and that's why
they could have these personal people I know, they could have afforded it, but they didn't do it because of whatever reason.
Why?
And they didn't,
because of probably the money.
No, but they were. I mean, they probably could have done it for like $100 a month, and they chose to spend that money on other things. They were just irresponsible, basically, in my opinion.
Okay.
But anyway.
Okay. So you're saying that people were being irresponsible and not, they were just spending their money on something else. Okay, gotcha.
Yeah, and they kind of were able to slide because they wouldn't get penalized. So that was good for them. But anyway, I know it didn't go far enough, and I know that, I'm hoping I've come now to this thought that I do want universal health care for everyone. I do want single payer. I wasn't totally sold on it before for whatever reasons, and now I believe. I believe. I want to pay.
You're
higher.
A believer?
I'm a believer. I want to pay higher taxes. I believe. No, I don't want to pay higher taxes. No one does, but I will make the sacrifice.
But don't you understand? Well,
what I mean.
Unless you're on Medicaid, if you're getting free Medicaid, free health care, that means you're being paid very little, and you're getting free health care. So then you would have to pay more in taxes. Well, but if you're an average person and working a job like everybody should and making enough money, then your health insurance is very expensive, and you wouldn't end up paying more in taxes.
Well, let me just say this. Let me just end it with this for me. if I had to pay higher taxes, let's just say if, I don't mind paying a little more for, like I said before,
So
health
that
and education.
where people can have,
Yeah.
that's very kind. That's
Well,
very
I'm
kind.
very,
But Kimber, not everybody feels that way.
well,
you know?
that's true. And I understand that because, I don't have a big family that I got to take care of,
Right, right.
so I'm in a lucky position that way, or unlucky, however you want to see it, but I feel lucky.
Yeah.
So anyway, maybe I would feel differently if I had a big family and I was just eking by, But one thing I do want to say, this whole COVID-19 thing has really exposed a lot of things. We do need universal health care because look at all these people that are worrying, like if they get sick, are they going to go to the hospital?
Another thing to bring up, I come from the bar and restaurant industry. And when you work for you get paid in California, it's minimum wage, but in a lot of states, it's, I think, $2.13 an hour. So if you miss work, even if you get whatever sick pay, which most bars and restaurants don't pay, you might lose a couple $100. So they go to work sick. And I remember going to work sick. I remember going to work with, whether it's just a cold or dragging yourself in with a fever and the flu. You are serving, 100 people in one night, and you're just spreading those germs. And I remember, my coworkers coming to work sick, or if you're only working 3 or 4 shifts a week, you can't take a day off. So universal health care would help with that. Well, because they could go to the doctor and they wouldn't just go to work sick. We need sick pay too for restaurant people. That's a kind of a different subject too. So we'd still have that issue. But there's so many things that I think what's in the media is okay, you and I, let's say we've decided that we would like single payer or Medicare for all or whatever. Well, we're the average person. We don't have lobbyists working for us trying to spread the word, except, we can do it on our own, share it with people on Facebook or whatever. But the insurance companies, the pharmaceutical industry, they have lobbyists and they're paying all that money. When we go online and we read this information, sometimes we have to look at where it's coming from and who, you don't even know who paid for it sometimes. Another thing I found in my research is the medical schools. So the pharmaceutical industry starts working on the med students when they're still in school, when they start. They, they give them the notepads with the name on and the pens, and they're almost kind of like brainwashing them with propaganda. So by the time they graduate from med school, they think how wonderful the pharmaceutical industry is and how much they've given them. And they do, they wine and dine doctors. They pay, now they get around, they're not allowed to bribe doctors anymore with gifts, but now they, let's say they're trying to get a doctor to, prescribe their prescription, their medication. So they can't pay them directly. So they have them come and speak at their convention and pay them $20,000.
Yeah, that's another way to get around it.
Yeah.
Yeah, you're right. That's the other thing I was going to mention, which you're already saying right now. Besides the insurance companies, it's the pharmaceutical companies that will fight this the most, And I think that's the biggest travesty of the whole, out of everything, is the astronomical prices that the pharmaceutical companies. I believe in a free market, but I believe there should be regulation, because look at with like Big Pharma, when they did that. Big Pharma was the Sackler family, I believe, and they were pushing.
The opioids.
And they were like suppressing the information that it would be addictive, and so doctors. Go ahead.
Another thing I was going to say about the pharmaceutical industry is, a lot of times they get a grant from the government, our money, and they do research and development, and they probably spend some of their own money too. But supposedly, from my research, they spend more money on marketing than they do on research and development. So we're paying for that. Okay. Then the deal is with the government, what they do is it's the Hatch and Something Act, I think. They have a deal with the government that if they discover some new medication that the government has given them a grant for, they get a patent for 20 years. So for the next 20 years, nobody else can compete. That's so we also have to put a limit on the price then. If we're going to let them have that patent that they can't, nobody else can compete to drive the price down, because it's supposed to be in the free market. That's what keeps everything in balance. Then we have to give them some kind of limitation on that too.
I agree.
Because, there's so many issues. It's so complicated that all of it needs to be addressed, not just one area. And that's why they say, when somebody's saying, well, it won't work because of this. Well, we should fix that too. We should fix all of these little issues instead of just one, because that's how it caves in and doesn't work when we're not looking at the overall, the
big picture. Yeah, that's true. That's true. It's, it's complicated. It seems like, as you know, from us talking, there's so many aspects of it that it's hard for the average American to understand exactly what's going on, because they get bombarded with so much information. Who knows,
Well, and you just, you read one thing like, well, there will be long wait times if we go to single payer. You have to think, well, what would make longer wait? Like, why? Why? So we have to start asking why more, instead of just accepting because I read it or because I saw it in MSNBC or Fox News. They said it. You have to think, well, that doesn't add up. Why would that make, happen?
Sure,
So,
for sure. If things don't make sense, I think
critical thinking.
Yeah, if things don't make sense to you in any aspect of anything, you should always question them.
Well, that's the thing. People aren't. It does make sense to people. They make it make sense. They just say there'll be longer wait times, and people are like, "Oh my gosh, I don't want to have to wait longer." What if I get cancer and I have to wait? But they're not asking, well, why would I have to wait? There'd be the same amount of doctors. It's not like we're gonna have less doctors. Well, and if they say we have less doctors, so we encourage people to go to medical school. We fix it. We fix those problems to make it work, instead of just saying, well, forget it. Nobody wants to be a doctor anymore because we have single payer. Forget it.
Yeah, I mean, that seems to be a thing that's gone around with a few different professions. Like, for instance, to become a pilot. A friend of mine was a pilot, and the new pilots that are coming up through the airlines, they're getting paid a lot less than back in the day, like the 60s and 70s, I guess, and it's a little scary to me, because it's like, I don't mind paying my pilot a little bit more if it gets me there on time, and not on time, safely, you know. There's certain professions that, are very specialized and very difficult and very stressful, and they deserve to make more money,
Right. Yeah.
I should be cutting costs. So anyway. Well, so do we miss anything? We got the pros and the cons,
let me see my notes. Yeah, I think I covered everything that I had in my notes. What about you?
Let's see. I'm looking at my notes. Medicare for all, we talked about that. Significant tax, we talked about that. Government.
I have one more thing while you're looking through your notes. So I have written down about any business that's for profit. Is profit comes first, and I think you mentioned that a little bit ago about putting profit over people, over health, and so I think the even now they're talking about with the COVID tests, people are questioning whether they're all positive, like, or when people die, did they really die of COVID-19, or does the hospital just get more money because anytime things are for profit, that also causes an issue. Causes a problem in business. It changes your priorities.
Yeah, I know Andrew Yang talked about that in his book too, the one we were talking about last time. Should certain professions be for profit? I don't know.
Yeah.
I mean, healthcare. I do. Yes, I want my doctors to make a lot of money, but all the other stuff that goes with it is kind of.
Well, the doctors should still be paid well.
Right.
The employees always get paid. Doctors are just employees. They always get paid well. But should the hospitals be making a profit, or should they just be non-profit?
Exactly. No, I don't know.
Cut out the insurance guys and all that. So anyway, so I guess to sum it up, Kimbra and I both agree that single payer might be the better way to go. We have questions, and we encourage more conversation. If anybody has comments that you want to point out something that we were wrong about, or a different way of thinking, please put it in the comments below, because we really, our goal with this podcast is to have a good time, but also to stimulate thinking and really encourage critical thinking instead of just accepting everything that we're fed by the media.
Yeah, I agree. And this is a significant time for this discussion to be happening because of what's going on with COVID, and also the elections coming up, and we want to know. It's kind of uncharted, scary times, and we want to know how we can get through this, make it better, right?
it's also exciting. And, I think I mentioned on one of our other podcasts, Eckhart Tolle, he says change always comes through pain. I think we are in pain right now, but by encouraging people to think a little harder on how we do things, America's an innovative country. I mean, we figure things out. Just we have to think about it a little bit more. And guys, I love watching a guy tinker in the garage and the contraptions and things that they come up with just in the house to make life easier and better.
Yeah, that's
I think
true.
we have to do that in all areas. And I think we are in a moment of change, and it's going to be fine. It's going to be
exciting.
positive. It's going to be good.
You're right. America has the best and the brightest. We really do. Sometimes we just need to think about this, a little bit more of a safety net. Not, it's just like a lot of people are falling through the cracks right now. And we really need to think about our whole society.
Yeah.
Don't you think?
Well, and I think, I think every country has very bright, wonderful people. I think we've been fed that we are the best, but
well, we're not the best, but we have a lot of bright people here.
But we all have minds, and we are fighters. We started this country out fighting for what's right, and now I think we all need to fight a little harder. I'm not of the school of thought that just being nice and being polite is how you get things changed. You have to ruffle feathers, cause friction, have uncomfortable discussions, and we have to stop accepting. I feel like a little bit we've become have
complacent.
A victim mentality too. That's the way it is. And, this is what I have to do.
We do a lot of blame.
I think America, we have more gumption than that. I think we'll figure it out and come through. So anyway,
it's a transitional time, but we will forge through.
We will survive and thrive.
Okay. All right.
Anyway.
Okay. Well, we'll see you next time. And please comment, as Kelly said.
Yeah, we want to hear from you. Give us your ideas. How can we make healthcare better?
Right.
For all.
Because we can, we'll personally do it, right? No, I'm kidding. Yeah. We're going to try.
No, but we should be, if we believe what the Constitution says, we are the government.
That's true.
So we just have to start being a little bit louder about our voice.
That's
and
true.
What we
That's true.
Want, be heard. So share with us, and thanks for listening. Thanks for joining us. Please subscribe if you feel like it.
Yeah. If you'd like to, please subscribe. We'll talk to you later. Bye.
Bye, Kimbra.
Bye.